So welcome to FASD Champions Connect, a series of Q&A style presentations by our champions for FASD prevention and awareness. Today, our guest speaker is Meagan Thompson, Doctor of Nursing Practice, Advanced Registered Nurse Practitioner, Certified Nurse Midwife, and Certified Lactation Consultant. So this is presented by nurse practitioners, midwives, and nurses partnering to prevent FASDs, which is a member of the Collaborative for Alcohol-Free Pregnancy. This project is supported by the US Department of Health and Human Services Center for Disease Control and Prevention, and the contents are solely the responsibility of the authors and do not necessarily represent the official views of the Centers for Disease Control and Prevention, the US Department of Health and Human Services, or the University of Alaska Anchorage Institute of Social and Economic Research. And we do also want to acknowledge that we gather today on the ancestral and traditional lands of the Dena'ina Athabaskan people. For thousands of years, the Dena'ina have been and continue to be the stewards of this land. It is with gratefulness and respect that we recognize the contributions, innovations, and contemporary perspectives of the Cook Inlet Dena'ina. We acknowledge that the University of Alaska Anchorage and other institutions were founded in the aftermath of influences that led to the exclusion and erasure of many Indigenous peoples, including those on whose land we live and work. This acknowledgement is just one step in the continuing process of working to dismantle the ongoing legacies of settler colonialism, including the racial, cultural, and political accusations and judgments of risk and blame associated with alcohol use and the role it plays in shaping and reinforcing stigma and stereotypes in our communities. And with that, I want to welcome again, let me stop this share. So we are focused on Dr. Thompson. Thank you again for being here today and agreeing to participate in this Q&A TED style kind of talk format. Thank you so much. I just want to make sure that I, explained everything. You're a doctor of nursing practice at the University of Iowa. Is that right?
That is, yes.
Oh.
So I am a certified nurse midwife. I am one of 8 in my practice, and I am a primary provider in the maternal substance use disorder clinic.
Wow, great. Can you tell us a little bit about how you came to learn about fetal alcohol spectrum disorders, or FASDs?
Yeah. So in my nursing program, we did talk a little bit about FASD. And then once I got into my midwifery training, that's when we learned a lot more about it. And in particular, I actually was very lucky to have a mentor who is an ACOG champion for FASD. And so she was really pivotal in my kind of growth as a perinatal substance use provider, and was probably the most meaningful introduction to FASD. And she was actually able to come and give a grand rounds at the University of Iowa, and through her work, that's how I was first exposed.
Great. And can you tell us about your work at the University of Iowa Hospitals and Clinics Maternal Substance Use Disorder Clinic?
Yeah, so our MSUD clinic is grant funded, and what we work to do is kind of change the way that people that have perinatal substance use disorder or disorders receive obstetrical care, and those do include alcohol use disorders, although that's not always the primary substance that we see. The MSUD clinic is midwifery led, but is most certainly interdisciplinary. So we rely on the expertise of our addiction medicine colleagues, of our social work colleagues, and then of our obstetrical colleagues to provide comprehensive care for folks that have any type of substance use disorder, including alcohol or histories. Often they have concurrent severe and persistent mental illness as well. So we work to screen. We also work to kind of coordinate treatment, or I'm able to provide the treatment for certain substances, and really try to provide holistic trauma-informed harm reduction and relationship-based care.
Great. And you said the clinic has an interprofessional focus. How do you, both as a nurse practitioner and a certified nurse midwife, work with your fellow clinicians at the clinic?
Yeah. Again, mentorship has been so meaningful in my career. Um, my first kind of step towards the MSUD clinic came when I partnered with an addiction medicine specialist. And so she also happens to be a family medicine physician. So she has worked in birth before. And how this works is she is mentoring me in prescribing buprenorphine, but obviously for our patients that have alcohol use disorder or methamphetamine use disorder, um, there is not necessarily a straightforward medication that we can use to treat in pregnancy. And so I work very closely with making sure that our folks can get in to see her and her team, that they receive adequate and thorough counseling from me, feel like they have a point person in their care. And kind of our running hypothesis is that it's really that relationship and that high quality care that will change outcomes, whether that's alcohol use or methamphetamine use. We really believe it's kind of non-stigmatized, non-judgmental care.
Yeah, that's so important, right? You can't build that trusting relationship if there is a feeling of stigma or bias. So yeah, that's really important. And speaking of that, alcohol use, especially alcohol use during pregnancy, is very stigmatized. How do you address stigma and create a safe environment for pregnant people at the clinic?
Yeah. During our first visit, I always kind of go through a checklist and we just chat about different things, including that, I feel like the space is intended to be judgmental free. And if they ever feel judged, then I ask that they feel like they can tell me. We also are just very transparent because I think a lot of times people not only feel the stigma, but also the worry about involvement of Child Protective Services or DHS. And so just being clear and transparent about what my role is in their care and what our state laws are and how the process works at our hospitals, I think is the best thing that I can do to help reduce some of that stigma and the fear.
Making sure that they're aware that, there are things that you have to do as, a healthcare provider and from a legal context, but also providing that safe space for them.
Exactly.
Yeah. Are there any other things you'd like to share about how you came to this and why you do it? Anything like that?
Yeah. Oh gosh. I feel like I came to perinatal substance use via incarceration and health disparities. So my undergraduate degree is in sociology, and I had certificates in women's studies and American Indian studies. And really what I tried to do was focus on kind of health disparities. And I would say that that was my introduction to looking at medicine through that lens. When I entered nursing, I quickly realized that people who, have lived in poverty or people who are incarcerated or have histories of incarceration were a group of folks that I really had a passion to provide care for. And then when I was in midwifery school, I taught a women's health class in a local jail. And it was really through those experiences that I learned the intersection between substance use and pregnancy and incarceration. And so that was kind of the beginning of my path that has led me to today, where all of those things are still true. We still mostly see people that have histories of being incarcerated or are currently involved in the carceral system. We believe that people that have substance use disorders really love their babies. And for some people feel like this is a hopeful opportunity to really make change with their addiction, although it is not always structurally possible or physically possible for them to make those changes. We also see a lot of people that are in domestic violence situations or sex trafficking. And so we recognize that these addictions can be really hard to change when you are in crisis or are in situations where you literally and physically do not have control. And so all I can say is for providers that are doing this work, we all know our patients are, have really tough lives sometimes, and that this work is so important and so emotional, but that it's meaningful.
And so how do the your patients find you? How does that work?
Yeah. Well, that is a process. So I will say that most of our patients are referred from within our own healthcare system.
Mm-hmm.
So the grant was actually funded to start screening. So we implemented the 5Ps, which was kind of my leading choice just based on doing some research. There are lots of screening options, which I'm sure other people have talked about. And hopefully at the new OB, people are screened. If they screen positive, then they're referred to us. There are also folks that come in crisis into our labor and delivery unit, and sometimes their follow-up care ends up being with us. And then there are folks that have heard about us through word of mouth, and that is continually growing as a way that people hear about us. Some of the work of this grant is to do more outreach, so to reach out to, in Iowa, we're very rural, probably much like Alaska, these small rural hospitals and clinics that are providing care and saying, hey, we believe that we're able to provide the best care for people that have perinatal substance use disorders. Please refer to us if you feel like you're unable to manage appropriately. And so we've also enlisted the help of our local justice system, since oftentimes people are, being incarcerated or being mandated to be in treatment, and then just kind of other local community organizations as well.
That's awesome, because one thing we do hear a lot, one fear of a lot of clinicians when they start screening for alcohol or other substances is, oh my gosh, what do I do if I encounter someone who could really benefit from inpatient or outpatient treatment, and on top of all of that, they're pregnant? What do we do? So we really need more programs like yours to help those people. But that said, for those people who are viewing this video, I think it's also important to acknowledge that for most people who are screened, right, they're not going to fall into this category where they need this intensive, immediate help. Most people are just going to benefit from even just the screening and being asked about the questions, considering their alcohol use, or if they are pregnant or planning to be pregnant, to consider stopping, or if they're considering becoming pregnant, considering to stop alcohol use. If they are pregnant, the best advice is to stop all alcohol use. Yeah. So we don't want to make that clear, because that is a fear of many clinicians, that, if I start asking, everybody's going to need help. That just isn't really the case. Yeah.
So about 10% of people probably should have at least like nicotine use, maybe marijuana, and maybe more depending on state or location, but it's like 2 to 5% of people that probably need perinatal substance use special care. Yeah.
Awesome. Well, those were all of my questions. So I want to thank you, and again ask if there's any other final thoughts you'd like to share with the people viewing this video.
Well, in my experience, what I will say is find a mentor, find somebody who's doing the work that you want to do, or the work that you think the people that you care for need. Definitely distance and rurality is a barrier to care, but oftentimes if people have insurance, we're able to kind of mitigate that. And also social work is so hugely important in our clinic and everywhere. And I hope everyone has access to social workers.
Social workers are fabulous. They seem to know everything and every sort of thing that's available in the community to help people. So again, I want to thank you, Dr. Thompson, for taking some time today to talk to us about your work. For those watching, please visit our website. You can reach it at tinyurl.com, ask about alcohol. We have training, professional resources, client resources, and materials for faculty to integrate into their nursing and midwifery courses. So again, thank you, Dr. Thompson, and all the best for a pleasant afternoon.